instructor, Ms. Jessaan M. Arguanon, and welcome to Teaching Physical Education and Health in the Elementary Grades. So we are now here in Unit 3. We will talk about the aerobic fitness. Unit objective. First, list down the benefits of the aerobic exercises. Determine the cardiovascular risk factor. Explain the principle of balance for an effective aerobic exercise program. Identify the bads that hinder fitness and health. Enumerate the different aerobic activities. Name the steps in starting an aerobic program. Identify the common injuries from aerobic activities. Cite the importance of warm-up in any workout. List down activities that may be used for warm-up. And lastly, determine the intensity of the workout that fits you. Now we come to the learning competencies. Kung ay ang competencies. First, learning competencies. It is to distinguish aerobic from the muscles and bone stretching activities. Explain how to optimize the energy systems for safe and improved performance. Engage in moderate to vigorous physical activities or MVPA for at least 60 minutes most days of the weeks in a variety of settings in and out of the school. So, dili lang sa sulod sa eskwelahan or during classes, but also outside our school facilities. Next, analyze physiological indicators such as the heart rate, the rate of perceived exertion, and pacing associated with the moderate to vigorous physical activities or MVPA to monitor and or adjust participation or effort. Lastly, to observe personal safety protocol to avoid dehydration, overexertion, hypo and hyperthermia during moderate to vigorous physical activity participation. Now we come to the topic 1, which we will talk about the aerobics. So there are benefits of aerobic exercises. They said that dancing helps you burn calories, strengthen your heart, and improve your endurance. So kung ganahan mo ma-burn inyong calories, ma-strengthen inyong heart, nga mga weak, nga mga marupok, and to improve your endurance. So let's learn to dance. So are you familiar with aerobics? Kada kasagaran ron kay Zumba, mga kuan it. So aerobics is a system of exercise done with accompanying music. Same ra siya sa Zumba. Then aerobic exercises improve cardiovascular fitness, respiratory capacity, muscular endurance. So, daghan kay siya benefits ang kaning aerobic exercises. They can also lower blood pressure and cholesterol levels. So, ang kaning aerobic exercise, kaning kitawag na lang under sa cardiovascular fitness, respiratory capacity, and muscular endurance. So, it's about our cholesterol levels and blood pressure. Next, we have the enhanced aerobic exercises enhance the ability of the body to move air into and out of the lungs and boost the flow of blood to all the parts of the body. Mas ma-enhance ang atoang pag-pump sa atoang heart. Diba? Mas madali. Mas makusog. Next, aerobic exercises offer another benefit. So, dili lang day katura sa cardiovascular fitness, respiratory capacity, or muscular endurance ang benefits sa aerobic exercise. Napadaylain. We have, first, aerobic exercises promote strong and healthy bones. As we grow older, our bones maibanan na ang calcium. They become weak and brittle. Gabok na kayo ato ang mga buko. Easily na kayo ma-fracture, mapiang, mabali. It's really a threat for us na labi nang mayandak ta. But however, various studies, nga na sila nga, they have shown to some extent that bones strength is related to physical activities. Kusgan kag buko kung daghan ka o physical activities. The bone is like the muscle, tends to get thicker the more it is used and exercised. So dagkog-bukog. Dili dali mabali, dili dali dali ra kay matumba, bahing ana. So pareha sila sa atong bones o sa atong muscles sa atong bones. Tingana sila nga kada gani mga paralyzed person, ang ilang parts sa body kabantay mo ang ilang muscles di na kay mo shrink, gamay mo hiyos. Ang ilang parts silang lawas kung dili na nila gamiton kayo kay dili na malihok, di ba? Same sa atong bones. Pero kung natay daghang physical activities, syempre our muscles, our bones will be more thicker. It gets more thicker the more it is used and exercised. So let's practice aerobic exercise kay nag-promote gini siya strong and healthy bones. Next, we have aerobic exercise helps control physical and emotional stress. It helps to improve your outlook in life and your self-concept. Ma-derive man ang imong kanang focus sa mga physical activities. Kung mag-exercise ka, di ba? Sometimes ang ato ang emotion kay ma-derive dito sa mga physical activities. It brings about a feeling of well-being and satisfaction. It helps to reduce anxiety and depression. So kung feel mo sa luya na kay ka, try to do physical activities or aerobic exercise. Aerobic exercise helps improve intellectual capacity and increase productivity. Makabright po ni. So in general, a fit individual can think, can understand, can remember, and respond more quickly. Huwag na isud sa imong hunang-huna. Kung physically active ka, the more na ang imuhang physical or imong intellectual capacity will increase. Dali ra kay ka maka-think, dali ra kay ka maka-sabot, maka-hinumdum, o maka-respond sa tanang mga butang. Kay permi man magamit ang atong intellectual capacity. So, di mo ingon nga kung sige lang kag sayo-sayo, kay dili na kay ka-bright, diba? So, mas bright di ay ang kanang mga daghang physical activities, kay ang ilahang body ng physical, dili lang sila dira hunong silang physical nga appearance, but also malabot sa atong intellectual capacity. Aerobic exercise is a realistic way to lose weight and keep it off. It helps burn calories. Kung mag-aerobic exercise ka, makatabang gina nga burn imong calories. And the exist body fats, and at the same time helps maintain your desired body weight. Kakita mo anang okay, so ay magurutan ng kuano kanang magkalit lang ka og ka niwang, your bones is not that, or mo muscles kay muyat-yat, pero lahi ang effect kung ningdaot ka nga nag-exercise ka, kay ma-firm ang imong muscles, dili mo yat-yat. Aerobic exercise provides significant protection from heart disease. Katong mga overweight or mga obesity, maka-remove dito sa mga bad cholesterol sa ato ang mga dugo. Nga ang kaning mga high cholesterol can lead to heart disease. So in the other hand, exercise promotes weight control, and thus imubo atong kaning low density nga mga fat. So exercise, ang kaning yung ato ang exercise eventually helps lower the risk of developing heart diseases. So kung na kay physical exercises, or especially aerobic exercise, ang kanang mga percentage nga naa ka sa heart disease is lower ang imuhang risk ana. Speaking of risk factor, we have first the cardiovascular risk factor. So, unsa din yung cardiovascular risk factor? It is a condition that is associated with an increased risk of developing cardiovascular disease. The risk factor may be classified as those that can be changed and those that can be changed and controlled and be treated. So a risk factor that cannot be changed. Kaya ang kaning mga di nato malikayan is first ang kaning family history, atong age, ug atong gender. Because kaning family history, kung nanay history ang family nga sakit, syempre if a first degree blood relative has naay kanang heart disease or stroke before the age of 55, for example, or 65, you might be at risk of contracting the same disease. Na dili man sa ingon nga kung hereditary, but kung same mo og balay usahay o digid permi mo magdungan og kaon, same mo og kinaon, diba? So naagyoy kanang posibilidad nga makuha to nimo pud nga sakit. Next, the age, ang atong mga edad. So through the years, the heart undergoes subtle psychologic changes. Even in the absence of disease, bisan pag wala kay sakit, but the muscles of the aged heart may relax less completely. Kung sa kuan pa nakaraan na, natiguang na po ang atong heart, bakong mo edad na gid ta. And as a result, the pumping, ang kana ng pag-pump niya ang dugo, may work less efficiently. Dili na kayo siya kanang sama sa pagka-function niya kaniadto. Panay possibility. Next, the gender. They said, tingnan sila nga, men are at greater risk of the heart disease than pre-menopausal women. Kaya nga naman, once past the menopause, a woman's risk is similar to men's. Muna yung gingon. The risk of the stroke, however, is the same for both men and women. Risk factor that can be controlled, changed, or treated. So, nato yung mga butang nga dili na ito malikayan kay tungkol sa itong family history, sa itong edad, o sa itong gender. Ba't kani makontrol gini na itong mga butanga? We have smoking, drinking alcohol, illegal drugs, hypertension, high cholesterol, physical inactivity, obesity, diabetes, and stressful living. Mao jud niya itong kinahanglan, usbon, kay ato aram na makontrol kung imong gi-choose na mag-smoke ka, sorry. So, kung imong gipili nga mga nigarilyo ka, inom ka og alcohol, gamit kag illegal drugs, o dili kay ka active sa imong physical activities, imong kinaon pod, syempre, you are risk nga magkasakit gud. If magkasakit gud ta, if dili na to ni tagaan og pansin kaning mga butanga, we are cardiovascular risk mo gyud ni mga butanga. So, principle of balance. So there are many aerobic exercises that qualify for an effective aerobic program. These include the breast walking, running, swimming or hiking, dancing, roller skating, kickboxing, swimming. You can also add Zumba and almost any other activities that will pump up your heart rate to the level where over sustained period of time. So, kanang mga exercises nga maka-pump, makakusog sa imong heartbeat. Tanaw ra kasi mong crush mo, kusog imong heartbeat. Dili na physical activities. Beneficial changes can take place in the cardiovascular system. They said, at the center of any effective aerobic exercise program is the basic principle of balance. So this principle encourages the right combination of the proper diet, regular exercise, and healthy lifestyle to attain well-being. It also applies to the moderation in all aspects of life. Drink moderately, smoke moderately, study moderately. Basta moderate, dili na to palabanan ang atong mga butang ng gipang buhat. So we have here balanced diet or diet. Ang akong pagtusa una nga ang diet kay di ka mukaon nga na, but dili ay dapat balanced diet. They said diet plays a crucial role in achieving and sustaining health and fitness nga naman. It includes the exercise, the rest, and the vitamins and supplements will not do much good in your effort to develop healthy body without proper diet. Bisan pag unsa nimo pag-exercise, pagkatulog 24/7 and vitamins, dili gyapon na siya mo effect kung wala tay proper diet. In fact, without proper nutrition katong mga pagkauna to, you may not even have the energy to participate in a regular exercise program. Bisan pag nag-stretching ra na sila, kung kuwang ka sa imong nutrition, di gyud ka ka-sustain ang mga butanga. So the condition of your body and the effectiveness of your workouts are directly related to the quality and the quantity of the food that you take. Depende gyud sa imong gikaon, gihabhab dira. So we have the principle of calorie balance. Now, mo ni atong relationship between the exercise and the diet. So kung ganahan ka nga ma-maintain ang imuhang weight, so gamito na tong isocaloric balance, wherein the energy nga gi-intake and the energy out is equal. Ang imong gikaon o ang imong gilihok is the same amount. So maintain yun na ang imuhang timbang, imong gibugaton. Pero kung ganahan ka mag-weight loss, we will use this negative caloric balance, wherein ang imong calories nga gikaon is gamay ra. Yang imong calories nga gi-out, yung energy out or imong physical activities is daghan. Gamay ka gikaon, daghan ka gitrabaho, daghan ka physical activities, of course muniwang gid ka. Lastly, the positive caloric balance is to gain weight. Kung daghan kay kagikaon, nya gamay ra kay kag physical activities, mo gini siya mo gain gid kag weight. Sabi na karon, kaon ra ka niya, magsige ra kag lingkod kay daghan kay kagibuhat. Siyempre mo dako gyud una ka tuntian no. Tambok gyud ta. So calorie balance is the balance between the calories from the food and drinks that you ingest, or calorie intake, and the calories that you burn through basic body functions, and the exercise is the calorie out. Now, napadita sa kaon. Balikon na to. So, they said na ang atong gikaon plays very important role in the quality of our life. Nga naman, food is the source of nutrients. Sa pa na, minerals, vitamins. But at the same time, it can be a source of happiness and pleasure. Nevertheless, more and more food, instant food, and preserved food without significant amount of nutrients flood na ay daghan nga dili kay siya nutritious nga pagkaon pero available na siya sa market nga ang mga tao nga mga busy ay wala time nga magluto or mag-prepare sa mga healthy nga meals. Of course kana gyud pamaliton, but a good balanced diet helps make and keep the body healthy and fit. Kanang may na lang no kanang mukaon kog hotdog sa una kaganahan kay ko pero idad-idaran ko murag kuan man murag ko kabuhion nalipay na lang po ko kay ron dili ko kanang mag-crave anang mga pagkauna kalagti na mga instant kay kabuhion ako. So ang kaning kuan medyo nakatabang pud nga dili na kaay ko mukaon og mga instant food and preserved food. Dapat ginato ni exercise ang kaning good balanced diet so that it can help to make and keep our body healthy and fit. It also helps to lower the risk of developing diet-related chronic nga diseases. Kalabi na kung matiguwang na ta. Edad-idaran na ta. Now, let's go to hydration. So, hydration is another essential factor in keeping the body fit and healthy while preventing the development of kidney stones and bowel cancers. So muna, kung di kayo tayo hinginom og tubig, ma-develop itong kidney stones. Diba? The lack or loss of fluids in our body causes dehydration. Nga, ang kaning ma-dehydrate ta, makuwang tag tubig, ma-stress day atong heart, itong blood vessels. And the body finds it more difficult to get rid ang mga init sa itong lawas kaya walang tayo fluid. Labi na gyud ang severe dehydration or when the water losses or more than 2% of body weight can increase the pulse rate, the body temperature, resulting in fatigue and decrease of performance. Kanang wahunta wala antay gana kay ikapoy na ta init ta kaya tong lawas kanang wala antay gana gyud nga maglihok-lihok kay uhaw naman. So a fluid nga mga tubig it intakes 2 liters or 8 glasses daily, pero karon kay summer man ron dapat up to 12 glasses gyud kung makaya no. It is really recommended to keep our body functioning efficiently. Dako gining tabang ng tubig. In addition, the water and beverages, the juicy, the watery fruits and vegetables, as well as the soups, can keep you well dehydrated. So, pwede rin na sila. But, dili ito pwede ka mga alcoholic drinks, mga soda. Dapat minimize. Dili kami ingon na undangon, but minimize lang yun. Next, we have the overload principle. Overload principle in exercise means that the body will adjust to the weight that is placed on it. During sa tong physical activities, the heart beats faster, the lungs work harder, and the muscles take on more strain than they usually do. Diba? Kana may exercise ta atong heart, diba dili? Kung naglingkod ra ka wala kay gibuhat. Itong heart kay wala gibuhat. Pero nag-pump siya slowly. Pero kung mag-physical activities ka, imong heart po, imong lawas po, nagpaspas po siya og beat, nagpaspas po siya og pump og mga dugo. The heart beats faster, the lungs work harder, and the muscles, sa matang muscles, kung asa ka mga bugat, the muscles take on more strain than they usually do. You will find that the first days of exercise is difficult. Ang atong first step good nga exercise is very lisod. Nga atong ma-experience ng body pains, mga fatigue, mga pamaul. Nevertheless, as you continue, kung ato nang i-continue with the exercise, the body is able to adapt kung unsa tong atong gipang exercise. Adapt to the load and overcome the stress. Kung sa una dita ka daw usa ka kilo, kung continue na to nga usa ka kilo atong alsahon, ma-adapt na sa atong body. After some time nga mag-exercise ta, ang katong we will able to do the exercise with a less effort than you started. Kung sa una galisod ka karon kay more simple na kay mga exercise. So kaning principle of overload, kung nakaya na si mong body nga makalsa kag 1 kilo, so pwede na ka mo add. You eventually increase the load. Kung nag-jogging kag 1 kilometer, sunod, kung makaya na, 1 kilometer and half, di ba? Eventually increase the load, lengthen the time. Kung 1 hour ka nag-exercise, pwede 1 hour and 10 minutes. The body's adaptation, ang growth and development take place after the workout, not during. Thus, exercising every day is effective to give the body time to adapt, to rest, to recover, and develop. Speaking of rest, now we are here in rest and recovery. Rest and recovery helps the body to reach its optimal level of development of performance. And during sa itong workouts, you place demands on your body beyond sa normal niya nga ginahimo. Hence, it is needs to rest and recover from psychological changes that take place. Physiological changes that take place. So, rest, kanang magpahuway ta, it enables our body to repair katong i-repair ang atong mga tissues nga nabina, strengthen itself, mas makusgan pa siya, diba? Recovery allows it to replenish energy. Ang recovery maulian ang atong energy, repair ang damaged tissues, diba? And remove chemicals that build up as a result the cell activity during exercise. So one way na to nga ma-achieve ang rest is through good sleep, which promotes the physical and mental health, including our hormonal balance. So kung mo-rest ka, nakay good sleep. Recovery can be achieved through the diet and hydration, among others. So atong gikaon ug giinom. Certain bad habits defeat your purpose to be healthy and fit. Kung natay mga bad habits, di na gyud ni nato ma-achieve ang atong gusto nga may healthy ta, nga ma-fit. So we have bad habits to be avoided. To gining di kaya na itong mga bad habits. Goodbye old habits, hello to change. So first, using steroids and recreational drugs. So unsa man siya mga butangan ni? sila anabolic steroids and synthetic hormones prescribed by doctors to treat specific medical condition. Naaragi mga drugs nga kanira dapat yan tambalan kung take niya wakay nga ning sakit ma-addict niya ka. But other than that, they're used for the purpose of enhancing an athlete's performance and strength is ng cheating kung magamit ka ng mga butanga. Kung kinsa itong nakakita itong sa una itong salida Shaolin soccer, maong guro to, na sila gi-inject sa ilang mga athlete nga mukusgan, diba? Magsiga na gaya itong ilang mata. It is cheating and it also prohibited by professional sports organization. Pero katong Shaolin soccer, friends manggod to sa ilang coach sa nag-organize sa soccer. Motong wala sila gi kuha nato. Wala sila gi badlong. Pero dapat di gina siya pwede. Diba? It is prohibited by the professional sports organization and medical associations. Pwede di taan ng mapriso kung athlete ka niya nagkuhan kag mga drugs, recreational drugs, di na siya pwede. Excessive na sobraan na ka niya, dugay na ka nagamit ng mga tambala, it may result to liver or madawat na mo liver or maka-cancer na, diba? Yeah, aggressive na imong behavior, lahi na ka. Dili na pareha sa unang akong normal pa ka. It also increase blood pressure or pwede kang heart disease, kidney tumors, and even death kung masubraan taning mga butanga. So recreational drugs such as pareha ng marijuana, heroin, cocaine, ecstasy, or solvent, it is really addictive. Muna yung mga examples sa recreational drugs. Kung excessive and prolonged use of these drugs may lead to abuse or addiction, which in turn may cause both personal and family problems such as domestic violence. Mahulata na ka. Or even mapatay na ka. Na relationship difficulties. Now, drinking alcohol. Pwede ra na siya, but in moderate. Moderate ra gyud dapat tigid sobra. Kaya ang sobra nakakasama. So, excessive and uncontrolled intake of alcohol can lead to alcoholism, dependence on alcohol, or alcohol abuse. It can impair judgment and dili na kahit wala tayo saktong pangisip. Labi nagmahubo. Diba? And most importantly, dapat ito i-take note, it can cause gastritis or an inflammation of stomach. Nanatay malnutrition because the person loses interest in food. Magsige na kag-inom, wala kay kaon, inom na kag-alcohol. It can result to liver disorders, cancers of liver, esophagus, or atong dila. Pwede nang magkakuha ta ng mga sakita. It can alter a person's normal living pattern and ruin relationship and careers. Nakakiila nga tungod sa iyang pagpalahubog niyang trabaho na apektuhan na kay kolektor man siya niya. Nainanghagad sila inom niya pagawa siya kwarta nga diya ha today ito yung ikolekta samot maruwin ang trust sa mga tao o ang imong pong trabaho pwede kang mataktak ang buhata. Smoking. Cigarette smoking is dangerous to your health. Pero may ginang i-advertise. Pero nganong naamgyapon ni. Natoy na hinumduman ako nga story sa kuang teacher sa una. Nga na siya nga. Kana daw naiuban nga dili nila dali-daling mahunong ang ilang panigarilyo. Nga naman. Gingan siya sa doktor nga kung mahunong ka o panigarilyo, mamatay ka. Possible din na nga na. Ano man na, kay kumuhunong daw siya sigarilyo, wanay mo kupot sa iyang lungs, sa iyang atay, sa mga iyang tanang nasa sulod, kay nangahilis na ang aso na ang dahil nagkupot. So kumustop siya, patay siya. Wow, giba kung tinuod na. But naging siya tendency nga cigarette smoking entice boys and girls of our age as a form of pleasure. Pleasure. Ganahan sila ni. O ana sila nga, cool. I'm tisoy. Pa? And a symbolic of passage of adulthood. Tiguang na sila. Na sila matiguang. Ako tiguang na kagingana. However, the bleak truth about smoking is that it increases the risk of cancer and heart and respiratory disease. Cancer, heart disease, o respiratory disease. So smokers, ang kaapan lang no kay ang smokers dili ang biya sila ang masakit. Apil po ang nagsimhot sa aso. Smokers have less endurance. Dili na kayo sila maka-endure o physical activities, poorer physical performance, and increased rates of injury and complication from the physical activities. Nahira ilang performance mo ng mga athlete, gi-discourage yun na sila nga magbisyo, labi na kaning smoke. Kay maapektuhan yun ang ilang performance as an athlete. Di na kay sila kanang maayo mo perform sa ilang dapat i-perform.